The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar today will discuss diet and nutrition for brain tumor patients. My name is Antoinette Tu, Program Manager here at the American Brain Tumor Association. I'm delighted to introduce our speaker today, Ms. Hannah Dalpiaz. Hannah Dalpiaz is an outpatient oncology dietitian at Dana-Farber Cancer Institute in Boston, Massachusetts. Hannah received her Bachelor's of Science degree in dietetics from the University of Arizona and completed her dietetic internship at Brigham and Women's Hospital. Hannah has a passion for oncology and nutrition and uses this to help develop individualized nutrition plans for patients throughout the spectrum of cancer treatment and survivorship. Thank you for joining us, Ms. Dalpiaz. You may now begin your presentation.
Good afternoon, and thank you for the introduction. Welcome, and as Antoinette said, today I will be speaking on diet and nutrition for brain tumor patients. The World Health Organization defines nutrition as the intake of food considered in relation to the body's dietary needs. We know that the body needs nutrition to function, but there are also lots of other reasons why you might eat. For some of you listening today, nutrition may be something that you've never given a second thought. For you, the answer to the question, why do you eat, may simply be that you eat out of necessity rather than for enjoyment. In contrast, some of you may arrive today as self-proclaimed foodies and love the process of planning meals to nourish your body. Whatever your reason for eating or your prior relationship with food looked like, I think it's safe to say that the diagnosis of a brain tumor, in one way or another, has likely changed your relationship with food and nutrition. Even if this diagnosis doesn't feel as though it has changed the answer to why you eat, it certainly can change the needs of your body, your ability to tolerate your diet, or simply just make you more aware of nutrition as part of your day-to-day routine. Brain tumors can have many implications for one's nutritional needs, and after a new diagnosis, you may come today seeking the optimal cancer-fighting diet. Today, we're going to look at nutrition as an integrative component of your cancer care and how it can complement more traditional medical therapies. Treatments for brain tumors can often include surgery, chemotherapy, radiation, or possibly a combination of all three. And today, I want to focus on ways to optimize your health before, during, and after these treatments, nutrition for alleviating symptoms and side effects related to treatments or brain tumors themselves, and finally a discussion of nutritional supplements, and then we'll end with an opportunity for question and answer. At this time, there are no specific known nutrition risk factors for the development of brain tumors. However, that does not mean there's not a role for nutrition in helping to enhance one's immune system and overall health before, during, and after treatment. It's important to focus on getting a balance of nutrients at meals before, during, and after brain tumor treatment. I want to begin by talking about what building a balanced meal looks like. For some of you, creating a balanced meal may be a concept that seems difficult or possibly even overwhelming. And later in the presentation, we're going to talk about ways to adjust your meal planning if you are experiencing symptoms that are preventing you from eating. The method I'm going to review for meal planning is often referred to as the balanced plate method, and uses your plate as a visual guide for building your meals. The balanced plate can help provide a framework for building personalized, balanced meals by picking and choosing foods that you enjoy. Before we actually start with building our balanced meal, it's important to understand the building blocks that make up the foods that we eat and look at typical portion sizes for these foods. Macronutrients are the energy-providing compounds that our diet is made of, specifically protein, carbohydrate, and fat. Each of these macronutrients has an important role in helping your body function. Protein is important for building and repairing cells in the body. It's also a key component of muscles, cells, and organs. Your body's need for protein can be increased in periods of stress, such as after surgery. Carbohydrates are made up of chains of simple or complex sugars and are broken down into the bloodstream as an energy source. Fat is also an important fuel source and is helpful in the absorption of nutrients in the diet and for building tissues and cells. Some foods are made up solely of protein, carbohydrate, or fat, whereas others are made up of a combination of one of two of these macronutrients. Protein can come from both animal and plant-based sources. Nuts and seeds are two examples of a plant-based protein, and in addition to providing protein, they're also great sources of fiber and heart-healthy fat. Beans and legumes are also plant-based proteins. Animal proteins provide zinc, iron, vitamin B12, and choline, and examples of animal proteins could include fish, shellfish, poultry, beef, eggs, and dairy. Examples of protein portion sizes would be 3 ounces of animal protein, a tablespoon of nut butter, such as a peanut butter or cashew butter, a half an ounce of nuts or seeds, 1 ounce of cheese, 1 egg, 6 ounces of yogurt, or for example, a cup of milk. Carbohydrates include grains, fruits, and starchy vegetables like peas, corn, or potatoes. Whole grains are an excellent source of fiber and B vitamins, and as a general rule, picking whole grains over more refined grains is beneficial because you get the added nutrition through additional nutrients and fiber. Carbohydrates, in terms of a serving size, could look like a slice of bread, a cup of ready-to-eat cereal, a half a cup of cooked cereal like oatmeal or cream of wheat, a 1-inch mini bagel. A serving of fruit could come from a cup of melon or berries, a half a cup of most chopped fruits, a medium-sized piece of fruit, a 1/4 cup of dried fruit, a 1/3 a cup of rice, half a cup of pasta, or 4 ounces of 100% fruit juice. The types of fat in the diet can be categorized as saturated, unsaturated, or trans fat. Examples of saturated fat include animal fats, butter and shortening. Unsaturated fats include oils, nuts, avocado, olives, flaxseed, and fatty fish. And trans fat is naturally occurring in small amounts in some meat and dairy products, but the majority of dietary trans fat comes from man-made sources. Trans fat is predominantly found in baked foods, fried foods, and processed foods. Trans fat can lead to a rise in your LDL, or bad cholesterol, and lower your HDL, which you may have heard referred to as your good cholesterol. It's best to avoid trans fat, limit your servings of saturated fat, and choose unsaturated fats in moderation to accent your balanced diet. Examples of fat portion sizes include a teaspoon of oil, butter, or mayonnaise, a tablespoon of salad dressing, 1/8 of an avocado, or 8 large black olives. Since most people don't carry measuring spoons, measuring cup, or scale with them at all times, it can be helpful to have a visual guide for estimating portion sizes. Having a grasp on portions can be helpful as you're adding foods to your balanced plate and snacks. So start by making a fist. Your fist is generally about a cup, and the front area of a clenched fist, where your fingers are, is roughly an estimate of a half a cup. This can be a helpful reference for fruit and vegetable and some carbohydrate portion sizes. A deck of cards, or the palm of your hand, is generally about 3 ounces. This can be helpful when estimating meat, fish, and poultry portion sizes. Your thumb, from knuckle to tip, is about a tablespoon, which is helpful for estimating servings of hard cheese or nut butters like peanut butter. 2 dice, or a matchbook, is generally about 1 ounce. And this can be a helpful portion size when thinking about nuts or dried fruit. So now that we've reviewed the basic macronutrients and portion sizes, we can move to putting meals together. Let's start by looking at breakfast. The circle on your slide represents your plate. Let's think about splitting your plate into equal thirds, with 1/3 of your plate representing a serving of protein, 1/3 of your plate representing a serving of carbohydrate, and 1/3 of your plate representing a serving of fruit. An example of what this meal could look like could be like the one pictured here. We have a half a cup serving of dry cereal with somewhere between 1/4 and 1/8 of a cup of almonds added to it, plus 4 ounces of milk and 1 cup of berries. You can build a balanced breakfast that fits your food preferences by choosing a serving from each of the columns listed here. Other examples could include something like 1 to 2 scrambled eggs with a slice of toast and a medium apple, or a slice of toast with 2 tablespoons of peanut butter and half a banana. Using the balanced plate method, lunch and dinner follow a similar pattern. Using the circle on your slide to represent your plate, you want half of your plate to represent your vegetable servings, 1/4 of your plate to represent your carbohydrate serving, and 1/4 of your plate to represent your protein serving. Here you see another example of what a balanced lunch or dinner could look like. Half of your plate is made up of non-starchy vegetables like bell pepper, tomato, onion, green bell pepper, and cilantro. A quarter of your plate is made up of 3 to 4 ounces grilled chicken, and a quarter of your plate is made up of either, say, a half a cup of grilled corn or a 6-inch corn tortilla. You could also accent this balanced meal with the 1/8 of an avocado or guacamole as your heart-healthy fat. You can also build lunch or dinner that fits your food preferences by choosing a serving again from any one of these columns listed here. Other examples could include something like 3 to 4 ounces of grilled fish with 1/3 cup of brown rice and a half a plate of Brussels sprouts, 3 to 4 ounces of chicken with a half a cup of quinoa and half a plate of cooked broccoli. Or you could even do something that's more of a bowl or a chili that could be comprised of 1/3 of you're serving 1/3 cup of beans or lentils with a half a cup of quinoa and adding in various vegetables to make up the rest of the chili. Balanced snacks can also be part of a healthful diet and oftentimes look like a combination of a serving of whole grain, vegetable, or fruit, plus a serving of protein. Examples of some balanced snacks could look like the examples here. For example, an apple or celery combined with 2 tablespoons of peanut butter, or carrots and cherry tomatoes plus 2 tablespoons of hummus. Other ideas could be something like an apple and peanut butter, low-fat Greek yogurt with 2 to 3 tablespoons of nuts, a smoothie that you've made with a half a cup of Greek yogurt, a half a cup of fruit, and a half a cup of milk, a half banana and almond butter, or even a hard-boiled egg with a slice of whole grain toast. So now that we've reviewed some of the basic concepts around meal planning, you may be wondering, is there one diet that's best for preparing for the treatment of a brain tumor, a diet that's best for managing the side effects related to a brain tumor, or just in general, supporting your immune system through treatment or recovering post-treatment? When evaluating any potential diet, it's important to ask yourself a couple of questions. Is this diet restrictive? Is this diet sustainable? And how is this diet going to affect my quality of life? When making diet changes, it can be helpful to start by looking at your current dietary habits with a dietitian to develop a plan that best meets your personal needs. When making any kind of lifestyle change, it's important to remember that even small changes can have a positive impact on your health, and it's better to make a small change that's realistic and sustainable than set a goal that sets you up to be unsuccessful. So while there may not be one specific diet for the management of brain tumors, there is increasing research to support the benefits of shifting to a more plant-based diet. Plant-based foods contain a variety of phytonutrients, which are the natural compounds that give plants their colorful pigment as well as their distinctive taste and smell. They essentially function as the plant's immune system and can offer immune protection to us when we consume them. There are thousands of different phytonutrients that help prevent cancer and can provide other protective health benefits. A plant-based diet is one that is rich in a variety of fruits and vegetables, but also includes whole grains, nuts, seeds, beans, and legumes. Some of you may choose to make a more gradual shift in your eating habits to move towards a more plant-based diet, whereas some of you may be looking for ways to make more significant changes and kickstart a shift to a more plant-based diet. Whether you're at one end of this spectrum or the other, or even somewhere in between, I want to walk you through some practical guidelines for making changes to boost the plant power in your diet. I'm going to take you through one food group at a time to discuss some possible additions and subtractions to your eating habits that can help you support a shift to a more plant-based diet. So let's start with looking at the protein category. For protein, a gradual shift to a more plant-based diet could look like designating, say, one day a week to choose a plant-based protein rather than an animal protein. When choosing red meat, for example, beef, lamb, or pork, limiting the portion size to 4 to 6 ounces, and a set a goal of limiting red meat consumption to less than 18 ounces at most per week, with the plan to avoid processed meats, which would include those that have been cured, salted, or smoked, such as bacon, ham, hot dogs, or deli meat. Examples of kickstarting a plant-based diet could be to designate somewhere between 3 to 5 or even more days per week where you choose a plant-based protein instead of meat or animal protein. Limit your consumption of red meat to less than 11 ounces per week with the avoidance, again, of all of your processed meats. You can use a variety of plant-based protein to replace animal proteins in your diet. This could include lentils, beans, hummus, nuts, nut butters such as peanut butter, almond butter, cashew butter, soy milk, black bean burgers, falafel patties, edamame, or even tofu. On the days that you do consume animal-based proteins, try and focus on lean options such as poultry, fish, eggs, and low-fat dairy. Here are some examples of portion sizes for plant-based protein options. It could include a ½ ounce of nuts or seeds, a tablespoon of nut butter, a ¼ cup of cooked beans or lentils, 2 tablespoons of hummus, or 2 ounces of tofu. Now let's look at some ways to boost the plant power by increasing the fruits and vegetables in your diet. A gradual change could be to aim to consume 3 servings of vegetables and 1 serving of fruit most days of the week, whereas a more accelerated goal would be to consume 5 or more servings of vegetables and 1 to 2 servings of fruit most days of the week. A serving of fruit or vegetables could look like 1 cup of leafy greens, berries or melon, a ½ cup for most other cut fruit, a medium-sized piece of fruit like an apple or orange, a ¼ cup of dried fruit, or again a ½ cup of 100% fruit or vegetable juice. When choosing fruits and vegetables, try and eat a variety of colors to get the most immune-boosting benefit, since different colors have different phytochemicals. For example, red fruits and vegetables are often rich in lycopene compared to orange fruits and vegetables, which are higher in vitamin C and flavonoids. Adding color to your plate can be simple. You can add color to the eggs at your breakfast by adding a variety of veggies to an omelet, or add fruit to your oatmeal or cereal, using the balanced plate to get in your veggie servings at lunch and dinner, or you can even boost the color in your snacks by focusing on adding fruits and vegetables. Now we're going to look at boosting the plant power through the grains in your diet. One way to improve the quality of the grains in your diet is to choose whole grains. Depending on if you want to make a more gradual shift or a more significant shift to a plant-based diet, you may consider making somewhere between 50% of your grains whole grains versus 100% of your grains whole grains. A whole grain, by definition, is one that is unprocessed and has the bran, germ, and endosperm intact, giving it more nutrients and fiber compared to refined grains, which are processed to have the bran and germ removed. You can identify whole grains by looking at the label for 100% whole grain as the first ingredient. For example, with the bread listed here, 100% whole wheat flour is listed as the first ingredient. A few other examples of whole grains would include barley, rolled oats, quinoa, popcorn, brown rice, and even buckwheat. So once you have some of these basic ideas for shifting to a plant-based diet, the next step is to put them together with the concepts we learned in the balanced plate method to create balanced meals and snacks. By selecting a plant-based protein plus a whole grain and a variety of vegetables, you can pack your meals with more plant power. While we know there are benefits to eating a colorful, balanced, and plant-based diet like the one I just described, I think it's also important to acknowledge that there may be times when this diet needs to be modified to account for the symptoms related to a brain tumor or its associated treatment. Symptoms related to a brain tumor may include difficulty swallowing, loss of taste, loss of smell, and nausea. Additional symptoms may be associated with treatments, including constipation, increased appetite, decreased appetite, nausea with vomiting and dry mouth. And in addition to symptoms related to the tumor and treatment, it's also important to consider symptoms that may be related to medications used as part of the treatment plan, such as anti-epileptics or steroids. Symptoms of these medications can include things such as elevated blood sugars and loss of appetite. We're going to look at these symptoms one at a time and discuss some of the practical strategies to improve your ability to eat with each one. Difficulty swallowing is also known as dysphagia. For some, this may be painful swallowing or may even be experienced as the sensation of food getting stuck with swallowing. This may be present due to neurological changes related to a brain tumor, or can also be present as the result of changes related to chemotherapy and radiation treatment. In some situations, if swallowing difficulty becomes more severe, it may require the assistance of a specialist called a speech-language therapist, who may be helpful in evaluating the safest consistency for you and teach you strategies and exercises to help improve your swallow function. If swallowing becomes difficult, a good place to start is to select softer and more moist food textures. Cut food into smaller pieces, chew well, eat more slowly than usual. Examples of soft foods may include chicken, egg, or tuna salads, yogurt or cottage cheese, eggs, hot cereals such as oatmeal, well-cooked or pureed vegetables, canned or cooked fruit rather than fresh, and you can also moisten food by adding sauces to help keep them moist and easier to swallow. The next symptom we're going to look at is dry mouth. Dry mouth can be associated with brain tumor treatments such as radiation and can make eating more difficult. When your mouth is dry, it may be difficult to eat some foods with dry textures such as bread, and I've heard many patients describe the sensation of eating with a dry mouth akin to eating sawdust. Some examples for managing dry mouth include eating smaller meals to help maximize the amount you're able to eat throughout the course of the day by spacing meals out, alternating bites of food with sips of liquid to help keep your mouth moist and make swallowing easier, adding broths, sauces, or gravies to foods to help keep them moist, sipping on fluids throughout the day to moisten the mouth, focusing on oral hygiene such as swishing and spitting with carbonated water to help moisten the mouth, sucking on hard candies or frozen grapes or melon can also help stimulate increased saliva, and it's also important to limit alcohol-containing mouthwashes, which can dry the mouth out further. Taste and smell are also both key in terms of how we experience food. A brain tumor may decrease one's sensation of taste or smell, whereas the side effects of chemotherapy may heighten one's sensitivity to certain smells and change your taste preference or how tastes are perceived. Taste perception can be even independent of a brain tumor or treatment, something that's very individual. So some of these strategies related to taste change may require a little bit more individual experimentation and the process of trial and error. When foods have no taste or the taste has changed, this can be a significant barrier to your desire to eat. If foods have little or no taste, you may find it helpful to utilize fruit marinades for protein, utilize lemons and herbs, spices, or even hot sauces to increase the flavor of foods. When foods taste off or differently than you expect, it can be helpful to trial fruity or salty flavors, as these are often taste profiles better perceived correctly by the palate. Lemon drops, gum, or mints can also help correct a bad aftertaste. Most of us tend to think about the importance of caring for our mouth or teeth after eating, but we rarely think about the benefit of oral care before eating. When foods taste off, rinsing your mouth or brushing your teeth before eating may actually help improve your taste perception during a meal. Making an oral rinse with salt, baking soda, and water can also be helpful for oral hygiene. If foods have a bitter or metallic taste, spices like onion, garlic, or chili powder may be helpful to improve the taste of your meals. You may also find it helpful to utilize bamboo, plastic silverware, or even chopsticks as an alternative to traditional metal silverware that may be more prone to exacerbate the metallic taste that you're experiencing. Experimenting with fruit-based marinades and sauces can also help to offset metallic and bitter taste. Some people find that these taste changes are more significant with red meat or chicken, so it may also be helpful to try alternative protein sources such as eggs, tofu, dairy, or beans. If water tastes funny to you, it may also be worth considering infusing fresh fruit or herbs like lemon and mint, or basil and strawberries to your water to help improve its flavor and keep you hydrated. When we think about the symptom of taste change, what we're actually referring to is the change in just one of the senses that the brain looks at when it perceives flavor. The brain processes taste, texture, temperature, and smell together when it sends a message to the body about the flavor of the foods being eaten. When one of these senses is altered, either related to a brain tumor or due to treatment side effects, it may be helpful to focus on the remaining senses to help improve your perception of flavor. One example of this would be if you enjoy oatmeal with cinnamon for breakfast, but have currently lost interest in it because it lacks the taste that you expect, you may be able to improve both your appetite for oatmeal and your enjoyment with eating oatmeal by smelling cinnamon in between bites. The association of this familiar smell with the process of eating oatmeal can actually help with the perception of flavor that you're having, even if the taste is lacking. Other strategies for helping improve your perception of flavor when your taste is off include alternating the temperatures of food. So for example, a hot bite followed by a cold bite, or even alternating the texture from one bite to the next. So for example, a smooth bite followed by a crunchy bite, etc. If your sense of smell is more sensitive than normal, it may be helpful to avoid being present in cooking areas during meal preparation. Try focusing on foods that are intended to be eaten cold or at room temperature, for example, smoothies, sandwiches, crackers and cheese, yogurt, fruit, etc., as these foods are less likely to carry an odor. Utilizing a cup with a lid or straw can also be helpful to reduce food odors of liquids and beverages. And depending on the time of the year, eating outdoors may also be helpful for reducing food odors and create a more pleasant eating environment. Constipation is the decrease in frequency of bowel movements and/or when bowel movements become harder or more difficult. This can have multiple causes, including medication, changes in the GI tract related to treatment, inadequate fluid intake, or inadequate fiber intake in the diet. Dietary strategies for improving constipation can include hydration. Fluid needs are variable from person to person, but a general starting point can be 64 ounces or 8 glasses of non-caffeinated fluid per day. Inadequate hydration can contribute to constipation by making stool hard and difficult to pass. Fiber is another factor that can contribute to constipation, and generally 25 to 35 grams of fiber per day is recommended. Whole grains and fruits, in addition to vegetables, are a great way to increase your insoluble fiber intake, but it's also important to remember that fiber intake should be increased gradually and while also focusing on increasing your fluid intake. If you increase fiber too quickly and without getting adequate hydration, it can actually worsen constipation and make you feel more bloated. Eating consistent meals throughout the day and not skipping meals can also help improve bowel regularity. Walking or moderate physical activity can improve constipation if these are appropriate for you. Hot beverages like tea, coffee, hot water with lemon, hot cocoa, or even hot cereals can also help stimulate the movement in your intestine to reduce constipation. And it's important to remember, if you're prescribed bowel medications by your doctor to help soften your stool or increase the frequency of bowel movements, to take these as ordered. A few examples of some snacks or mini meals that could be helpful with constipation include oatmeal with walnuts and ground flaxseed, scrambled eggs with black beans, spinach, salsa, and half of a whole grain muffin, or shredded wheat with fresh berries and milk, and an addition of ground flaxseed, or even a homemade apple and prune sauce. The definition of diarrhea can be a little bit trickier because it can look so different from person to person. Generally, diarrhea is thought of as an increase in bowel movements by 3 or more per day compared to your usual, or a change in the consistency of your bowel movements. Diarrhea can be caused by chemotherapy or medications and can result in dehydration, decreased absorption of food, and decreased appetite. If you suspect that certain foods may be triggering your diarrhea, a food log can be a helpful tool to identify food offenders. This can be done by tracking the time of day, what food was eaten, and how you feel at intervals, for example, 30 minutes after eating, and in addition to the time to your next bowel movement. This can help identify if there are foods that might be making your diarrhea worse. For some, reducing the content of fat, insoluble fiber, and lactose in the diet may help alleviate the symptoms of diarrhea. Small frequent meals and snacks can also be a way to ensure that you're getting enough nutrition in, even if you're not feeling as well or aren't up for larger meals related to your symptoms. Bulking agents such as soluble fibers can help improve the consistency of your bowel movements. Examples of soluble fibers would include applesauce, an apple without the peel, oatmeal, potato without the skin, and white rice. And it may also be helpful to avoid any sugar-free products, particularly those that use sugar alcohols, as these can oftentimes worsen diarrhea symptoms. A few examples of diarrhea meals and snacks could include saltines on toast with creamy natural peanut butter, hard-boiled or scrambled eggs, ripe melon, oatmeal with canned fruit, or even a cup of plain Greek yogurt with cooked berries. Fatigue is also a symptom that can often accompany cancer, its treatment, or surgery. If you're feeling increased fatigue, this can pose many nutritional problems, such as the inability to prepare your own meals and decreased interest in eating. Although you may be able to attribute some degree of fatigue to a tumor itself, treatment, or surgery, it can also be related to inadequate intake of calories and/or protein. This can create a very vicious cycle when not having enough energy to prepare meals results in eating less, which then in turn results in increased level of fatigue. So when you're feeling fatigued, it's important to focus on meals that require minimal time and effort to prepare. It may be helpful to utilize a crock pot to prepare meals that allow you to minimize time spent in the kitchen. You may also find it helpful to cook larger batches of meals at one time, allowing you to streamline prep work for meals. And by doing it all at one time, and then freeze meals or portion them out to eat throughout the rest of the week or month. When you're feeling fatigued, it's important to maximize the calories in every bite you're eating. Heart-healthy fats are a great way to boost the calories in your meals in a healthful way. You can do this by adding nuts, avocado, nut butter, or even a drizzle of olive oil to meals and snacks. It may also be helpful to keep non-perishable snacks on hand at work, at home, or even while you're running errands or to appointments to keep up energy and also avoid skipping meals, which can further increase fatigue. Examples of snacks could include dried fruit and nuts, peanut butter and whole grain crackers, a piece of fruit and a handful of nuts or peanut butter, or even a homemade trail mix made up of something like nuts, dried fruit, and dark chocolate. If you become easily fatigued during meals, you may find it helpful to choose softer, easier to chew foods, which require less effort to be eaten. Some examples of this could include soups, egg, chicken or tuna salad, or even a flaky fish. Small, frequent meals can also be helpful when you're feeling fatigued. Eating every few hours rather than relying on three larger meals a day can help you get in more calories even when your energy level is poor. It can also be helpful to take advantage of the time of the day when your appetite is best and focus on eating meals and snacks at that time period. You may also have loved ones around who are looking for ways to help. By taking advantage of these offers, you can help conserve your energy. Ask for assistance with meal preparation or even other simple chores around the house so that you can focus on using energy to eat. You may also find that even doing light amounts of physical activity or even small amounts of your normal day-to-day activities can actually help counteract feelings of fatigue. Another possible symptom is decreased appetite, which could include the loss of overall appetite, the loss of the desire to eat, or could also be related to feeling full more quickly than usual. Strategies for eating with decreased appetite include eating smaller, more frequent meals and snacks. This allows you to eat less at one time, but get more nutrition in throughout the course of the day. A few examples of mini meals could include whole wheat toast with peanut butter, oatmeal with nuts, a scrambled egg, or a chicken salad with crackers. Many people find it easier to take 4 to 6 small meals throughout the day rather than 3 larger meals. And you may also find it helpful to eat from smaller plates or bowls, because this can make the quantity seem less overwhelming. When your appetite is poor, large portions at meals may unnecessarily cause anxiety and stress at mealtime, which rather than helping improve your intake will actually oftentimes result in you eating less. Increase the calorie and protein content of meals. This can be helpful when your appetite is poor. You can do this by increasing, again, the heart-healthy fats, and this allows you to increase the calories you're consuming without increasing the total quantity that you have to eat. So let's look at an example of some ways that you could boost the calorie and protein density of your breakfast. So for example, if you normally eat oatmeal, you could boost the calories and plant power by adding something like a handful of berries. You could increase protein and calories by adding peanut butter, protein powder, or even mixing in a scoop of plain Greek yogurt. You could also increase the calories by making oatmeal with milk instead of water, or even adding something like a drizzle of olive oil. You may find that rather than waiting to eat when hungry, you may need to utilize the clock to make sure you're getting enough nutrition even when your appetite is poor. Setting a timer for every 2 to 3 hours as a reminder to try eating a meal or snack may be helpful. When your appetite is poor, nutrition supplements or smoothies or even the use of homemade or commercial supplements may be helpful to get in your additional calories and protein. Some people find that it's less filling to sip on their calories spread throughout the day than to have a large plate of food presented to them. So you may even find that this can be helpful, and even using something like a nutritional supplement or a smoothie to take your medications can help you get in extra calories and protein with each sip throughout the course of the day. Light physical activity can also help to stimulate appetite if this is appropriate for you based on a discussion with your doctor. When building your own smoothie or shake at home, you have the flexibility to mix and match flavors based on your current taste preferences. You could start with something, for example, like milk, yogurt, or other liquids as the base, and then add in fruit or vegetables and for additional flavor and nutrients. If you're looking to pack in the most nutritional power with each sip when your appetite is poor, here's some other ideas. Avocado could be added to increase calories and also add a creamy texture. A drizzle of olive or canola oil could be added to boost the heart-healthy calories. Greek yogurt could be added for an extra boost of protein. Something like spinach or kale could be added to get in additional vegetable servings when you might not feel like eating these foods on their own. Peanut butter or other nut butters like almond, cashew, or sunflower butter or even a scoop of protein powder could be added for additional protein. Nausea and vomiting can be caused by chemotherapy, radiation, pain, fatigue, constipation, medications, or even brain tumors themselves, and can significantly impact one's ability to consume food and fluids. Uncontrolled nausea and vomiting can result in loss of electrolytes, dehydration, the loss of appetite, and even weight loss. You may have noticed a recurrent theme here, but eating 6 to 8 small meals throughout the day rather than 3 large ones can be helpful when you're feeling nauseated. By focusing on small, frequent meals throughout the day, you're able to get in more calories, hopefully without exacerbating your symptoms. Avoid eating in a room that's too warm or that has cooking odors or other smells present. Grilling can help take the smell of food preparation outdoors. Eating outdoors can also be an option to help reduce food smells when eating, as can the use of an overhead fan in the kitchen to decrease cooking odors. When reheating foods, I recommend using the stovetop or oven rather than the microwave because this can also tend to make food smells linger for longer. Limit greasy, high-fat foods as these tend to take the longest to digest. You may find it helpful to focus more on bland, soft, and easy-to-digest foods when you're feeling nauseated. Particularly if food odors trigger nausea for you, it may be helpful to focus on foods that are meant to be eaten colder at room temperature, like we talked about before, since these tend to have less odor associated with them. A few examples include cottage cheese with vegetables, yogurt with fruit smoothies, peanut butter and crackers. If you're prescribed nausea medication by your doctor, it's important to take these as directed and try and focus on planning meal times around when your nausea is best, especially if it's being controlled with medication. If you're on pain medications, try and take these with a light meal or crackers to help prevent exacerbating nausea by taking them on an empty stomach. Lemon can be a go-to nausea remedy for many individuals. Lemon aromatherapy can also reduce nausea, even just through the act of smelling a fresh sliced lemon. You can also squeeze lemon juice onto foods that you are eating, suck on a fresh lemon, add lemon to water or tea, or even add a splash of lemonade to your water to help reduce nausea. Similarly, ginger is commonly utilized as a treatment for nausea to ease digestive problems ranging from motion sickness, gas pains, to even chemotherapy-related nausea. You can make a homemade ginger tea to sip on throughout the day by peeling and slicing a fresh piece of ginger about the size of a nickel and steeping in hot water. You may also find choosing recipes that use ginger, sipping on small amounts of ginger ale, or even chewing or sucking on ginger candies to be helpful. It's also important to focus on staying hydrated, particularly if you're having episodes of vomiting. If water is not appealing, experiment with different fluids such as decaf teas. You can also mix up your plain water by adding a splash of lemonade to the water or infusing the water by adding fresh sliced fruit, vegetables, or herbs. Examples of possible combinations could include cucumber and fresh melon, lemon and mint, basils and strawberry, sliced citrus, or even utilizing the lemon and ginger that we just talked about. Simple, easy to digest foods like crackers, plain toast, or pasta may help settle your stomach and allow you to eat better throughout the rest of the day. The tendency can often be to skip meals due to nausea, but for many this actually creates more nausea, can worsen the nausea, and creates a very difficult cycle to break out of when feeling nauseated results in eating less, which in turn worsens your nausea. You may also find that medications like steroids can actually increase your appetite. To prevent excess weight gain in the setting of an increased appetite, it can also be helpful to have balanced snacks on hand that help satisfy hunger and still provide you with balanced nutrition. Ideas of balanced low-calorie snacks could include something like 10 almonds with a half a banana, half of an apple with a tablespoon of natural peanut butter, half a cup of low-fat cottage cheese with a quarter cup of fruit, or even something like a part skim string cheese stick with a half a cup of grapes. It can be helpful to portion out snacks ahead of time to prevent overeating when your appetite is increased. And hydration is also key to ensure that you aren't mistaking thirst for hunger. If you're struggling with elevated blood sugars related to steroids, focusing on balanced snacks can help improve your blood sugar control. Carbohydrate, one of the 3 macronutrients we talked about earlier in building the balanced plate, is the food group that breaks down into sugar in the bloodstream through digestion. You can improve your blood sugars by focusing on fiber and protein content of your foods. Choosing whole grains, which are higher in fiber, can slow how quickly sugar is released into the bloodstream after a meal or snack, improving your blood sugar control. You can also improve blood sugars by pairing carbohydrates with protein, which also in turn slows the release of sugar. Using the tools we talked about earlier to build balanced meals and snacks with the balanced plate method will also help support improved blood sugar control. So many people turn to dietary supplements or other herbal products as a way to improve their health, help with the side effects related to cancer or its treatment, or in some cases, possibly even to treat cancer. If you enter supplement and cancer into Google, you will find no shortage of supplements that pop up suggesting they can cure, treat, or help manage cancer. In 1994, Congress passed the Dietary Supplement Health Education Act, which defined a regulatory framework for supplements and defined dietary supplements as products taken by mouth that provide ingredients intended to supplement the diet. This could include vitamins and minerals, herbals and botanical products, amino acids, and other nutritive dietary substances. There's limited research and evidence regarding the effectiveness of many supplement products, and much of the research done looking at supplements and cancer has been inconsistent in its ability to show benefit. When considering taking a nutritional supplement, it can be helpful to keep a couple things in mind. Manufacturers do have to follow good manufacturing practices to ensure that supplements are processed consistently and meet quality standards. However, there is no way to make sure that the right ingredient is included in the appropriate amount. In other words, despite these good manufacturing practices, there's actually no way to guarantee exactly what is in a supplement that you're taking. Supplements do not have to be approved by the FDA to be produced. In fact, in contrast to prescription or over-the-counter medications that must be proven safe before they can be sold to the public, a supplement can be sold until it is proven unsafe. The FDA is responsible for monitoring supplement safety and has the ability to take action against manufacturers if a supplement is deemed unsafe. However, the FDA relies predominantly on consumer reports of adverse effects to monitor for safety. In other words, they're relying on people who are taking these supplements to let them know when adverse reactions are coming up before they're able to take action against a manufacturer. Supplements can also interact with prescription medications and even chemotherapies. Herbal supplements have the potential to actually worsen chemotherapy side effects, and in some situations could possibly reduce the effectiveness of your treatment. Radiation and some chemotherapies kill cancer cells by creating free radicals. Free radicals are normally found in the body and help kill certain types of bacteria and fungi and also help regulate cell growth and destruction. Antioxidants, in contrast, in your diet, help protect cells from damage done by free radicals. So if you're receiving a chemotherapy that works by creating free radicals and you take a supplement that's meant to bind free radicals, you may actually be limiting the effectiveness of some of your treatments. Supplements that would fall into the category of antioxidant would include things such as beta-carotene, coenzyme Q10, vitamin A, vitamin C, vitamin E, zinc, and selenium. When considering a nutrition supplement, it's key to consider both the safety and the efficacy of the supplementation. It's very important to discuss with the members of your care team, including the doctor and the dietitian, if you are currently taking or considering taking a nutritional supplement, as they can really help you delve into evaluating the safety and efficacy, and in addition to that, the research that's out there about any particular supplement. Rather than taking nutritional supplements, my personal recommendation would be to focus on making balanced and colorful food choices. It's better to get the variety of phytonutrients from whole food sources than as a concentrated supplement. No one single phytochemical, vitamin, or mineral has thus far been proven to protect from cancer. But we don't necessarily know that by isolating one nutrient outside of the food source that it's going to have the same benefit. And in fact, evidence to some extent suggests that many compounds working together offer the strongest cancer protection. This is likely because when consumed as part of a rich diet in color, you get the variety of vitamins, minerals, and phytochemicals that have the opportunity to work synergistically in the food, as opposed to pulling out one individual nutrient and providing it in a high-dose supplement. The following websites are databases of herbs and supplements that might be useful if you're taking or considering taking a nutritional supplement. They allow you to type in any supplement you're interested in and review the information on both possible mechanism of action for the supplement, possible and reported adverse side effects of the supplement, possible drug-nutrient interactions for any other medications or chemotherapy regimens that you may be on, and also give a rank of the safety of a given supplement and whether there's any risk of harm. In terms of some other helpful resources, if you're looking to expand your nutrition knowledge related to brain tumor or cancer in general, the American Brain Tumor Association website has some great resources available on nutrition during brain cancer treatment. The Dana-Farber Nutrition website has great information on recipes, symptom management strategies, the opportunity to ask the nutritionist various questions. And we also have a phone app available for both Android and iPhone if you're looking to have those questions, answers, and recipes with you on the go. You can also utilize the Academy of Nutrition and Dietetics Oncology Nutrition website for additional resources, question and answer section. And the other advantage of this website is it gives you the opportunity to enter in your zip code to help find a dietitian local to you if you're looking for a one-on-one consultation to help support your journey through brain tumor treatment as well. So these are my references, and thank you for joining me today. We'll now have the opportunity for some questions.
Thank you so much, Ms. Dalpiaz. Ms. Dalpiaz will now take questions. If you have a question you would like to ask, please type and submit it using the question box in the webinar control panel on the right-hand side of the screen. The first question is there any good food for white blood cell count? I've been struggling with this since I started chemotherapy.
So oftentimes the white blood cell count is often driven down by multiple chemotherapies and medications. So there's not specifically a food that can counteract that level. However, oftentimes what you're feeling with those decrease in the white blood cell count is increased fatigue. So oftentimes focusing on the variety of nutrients and getting enough protein in the diet is really important for helping support the symptoms you might be feeling related to a low white blood cell count.
Great. Let me see. There's another question. Is the ketogenic diet actually beneficial to an adult brain cancer patient?
Great. So this tends to be a very hot topic of conversation. So Ketogenic diets have actually been around since the 1920s as part of treatment originally for epilepsy. Research now is looking at the ketogenic diet in a number of ways for weight loss, heart disease, dementia, and even cancer. Specifically, there's some initial research being done in terms of glioblastoma patients. So a ketogenic diet is more than just a low-carb diet. In fact, a classical ketogenic diet actually involves eating a diet that has close to 3 to 4 grams of fat for every 1 gram of carbohydrate plus protein. The goal of this diet is to encourage the body to use fat and then in turn ketones instead of carbohydrate to put the body in a state of ketosis. So there's interest in this diet for patients with brain tumors because our brain actually prefers glucose or carbohydrate as its energy source. So the hypothesis is that cancer cells in the brain and in turn their growth could be sensitive to not having this preferred energy source, and potentially that could impact progression or growth. At this point, the evidence is very limited, mostly to lab and animal studies with just a handful of case reports in humans. While there are several clinical trials ongoing, and I think we will know more in the coming years, at this point, there really is a need for more well-designed, large, randomized control studies for us to really be able to judge the effects of the ketogenic diet, not only on quality of life, but also progression of disease before we can confidently recommend it as a diet for primary brain tumor patients. I think knowing that it is also a very restrictive diet, it's not to say anecdotally that some people don't partake in this diet, but I think it's incredibly important that if it's something you're considering, that you do it under the close supervision of a physician and a dietitian who specializes in the ketogenic diet to make sure that you're not losing ground with your nutrition while you're on these extreme restrictions.
Great. What is the importance of eating anti-inflammatory foods during radiation, and do you recommend any anti-inflammatory foods for this purpose?
So along the lines of those phytonutrient-rich foods that we talked about in terms of the different colors in the diet. So the benefit that you see there is that overall, those foods do have an anti-inflammatory impact. And the more color that you're eating in the diet, the more immune benefit you're taking on from the different qualities of those foods. So I think the main benefit of eating the color is really to help both with your immune system throughout radiation and also to help support your tolerance of treatment. I think it is also important to highlight that, again, my recommendation would be to take those in food form as opposed to the isolated supplements, also because when those extracts are taken out in high dose, that's where we would have a concern that they could in fact be interfering with the efficacy of your treatment, whereas when you're taking it as part of the whole food, there's less of a concern of that nature.
Great. How do I get in touch with a registered dietitian at my hospital?
So depending on the setup of your hospital, oftentimes if you ask your oncologist or your infusion nurse if there is a dietitian available on staff, that would be a great starting point. Another option, if your specific cancer center does not have a dietitian on staff, would be to go through the website that I listed in the references under the Academy of Nutrition and Dietetics Oncology Nutrition website. And you can actually search specifically to a dietitian that's local to you and could also seek someone out that way, either on your own or request that your oncologist refer you to a dietitian.
Great, thank you for pointing out that website. That's very helpful. Does sugar feed brain tumors?
So as I mentioned a little bit with the ketogenic diet, glucose is one of the preferred fuel sources for the body, particularly for brain function. I think this is oftentimes where sometimes things get misinterpreted as sugar specifically feeding cancer. While we do have concerns about significant sources of added sugar in the diet, that's not to say that consuming a sugar-containing food or a naturally sugar-containing food, such as vibrantly colored fruits, is going to have a one-to-one relationship in terms of eating that food and accelerating the growth of a tumor anywhere in the body. I think what we tend to focus on in terms of the connection, the sugar and cancer connection, is limiting sources of excess added sugar in the diet and focusing on getting your carbohydrates or foods that break down into sugar in the body from whole grains, from your colorful starchy vegetables, and from your colorful fruits, as opposed to sources of sweets or added sugars in the diet.
Thank you. Are there any superfoods that are especially high in nutrients to strengthen the immune system that you would recommend?
So what I would definitely recommend is going back to those colorful fruits and vegetables. As opposed to just one specific food, getting the most color that you can get in. You may have heard it referred to as, for example, eating the rainbow or eating your colors. And really what that refers to is that the more colors you're eating, the more rich nutrition benefit you're getting from all of those variety of both phytochemicals and antioxidants. So rather than picking one, say, superfood, I think the more important thing would be to spread the color amongst your fruits and vegetables throughout the course of the day in your diet.
Thank you. Are there certain foods that interact with medications that brain tumor patients are on? Are there certain foods to avoid?
So in regards to specific foods to avoid, it would be a little bit challenging to speak to that one specifically, just because there can be so much variability in the medications that each individual here today might be on. One helpful resource if you are looking for drug-nutrient interactions, if it's related to a supplement, any of the websites listed here could help identify if it's a supplement. In terms of a food specifically, I wouldn't anticipate an interaction, but that being said, there are other heart medications that do have interactions. For example, some medications have an interaction with grapefruit. But it's hard to speak to every specific medication. What could be helpful is to ask your oncologist or the pharmacist at your specific infusion center if they have any recommendations, or even if you're picking up your medications at a local pharmacy, they can give you any information about drug-nutrient interactions for anything you're prescribed currently.
Great, thank you. Is going organic important in finding food choices?
So this also tends to be a pretty hot topic in cancer and nutrition. So in terms of organic foods, there really aren't any randomized control studies to suggest that organic foods have improved benefit over your conventional fruits and vegetables. Organic is going to have lower incidence of pesticides and additives to the vegetables. That being said, if it's the difference between choosing an organic piece of fruit or an organic vegetable and going without the vegetable altogether, I would rather you go with the conventional than cut them out of your diet. Some people do find that they have a preference for organic fruits and vegetables. That can be a little bit more pricey. So one of the resources that can be helpful if you're trying to decide and weigh that cost benefit with going organic, the Environmental Working Group, every couple of years, and if you just search Environmental Working Group, I believe it's .org, puts out a list referred to as the Dirty Dozen and the Clean 15. And basically what this does is gives you a list of the dozen foods that tend to have the highest pesticide incidence that might give you the most bang for your buck, so to speak, in terms of choosing organic versus the Clean 15, which tend to have the lowest incidence. The advantage there could be if you're kind of on the fence about going organic, it can help you kind of prioritize some of that cost benefit. And again, that's the Environmental Working Group. And if you Google that, you'll come up with a list of the Dirty Dozen and the Clean 15.
Great, thank you. We have time for one more question. Is biotin good for hair regrowth? And which foods are rich in biotin?
So biotin would fall in the category of some of your B vitamins. And there is the potential that it is involved in the process of growth of tissues in general. I would recommend, rather than doing biotin in supplement form, again, to eat foods that are rich in biotin, which you could get through doing whole grains in the diet, so whole grain breads and those sorts of sources, and also through doing a variety of those colorful fruits and vegetables.
Thank you. Again, that is all the time we have for today. So thanks all for joining us, and thanks again once to Ms. Dalpiaz for her wonderful webinar presentation. I just wanted to remind you, besides our free educational webinars, ABTA does have a variety of programs available to help connect patients and caregivers with information and resources to help support them in their brain tumor journey, as well as publications and resources for healthcare professionals. For more information, visit ABTA's website at www.abta.org or call the ABTA Care Line, which is staffed by caring professionals, at 800-886-2282. Let's pause just for a moment to conclude our webinar recording.